Hi, everyone. I'm Michael Chesney.
And I'm Megan McGurman. Welcome to another episode of For the Love of Health, brought to you by ChristianaCare.
According to the World Health Organization, worldwide obesity has tripled since 1975, and obesity is a very serious chronic health condition.
Weight management can be complicated. It's not always just about willpower and poor food choices. Joining us today to talk about a comprehensive approach to weight loss is Dr. Caitlin Halbert, a bariatric surgeon and chief of surgical services at ChristianaCare's Wilmington Hospital, and Dr. Lisa Breslow, bariatric medicine specialist based out of ChristianaCare Primary Care at West Grove.
Caitlin and Lisa, thank you so much for being with us today.
Thanks for having us.
Yeah, we're excited to be here today.
Yeah.
So as Michael mentioned, the obesity rate in America is going up. Why is that?
So if we go back to the late 70s, early 80s, around that time is when we really started to see that uptick in obesity. And although it may not be the only factor, around that time, people started to kind of consume more ultra-processed foods. But I think, too, if we look back just in the past 10 years, we look at obesity rates in kids, and why another reason why that could be happening is because of screen time, right? Like lack of physical activity, in addition to the ultra-processed foods, fast foods, portion sizes, things like that.
Portion sizes have almost tripled in the last decade, and you can correspondingly see from the 90s to early 2000s, the rate of obesity had doubled in all states across the U.S., and that certainly wasn't that wasn't any different here in Delaware.
Yeah.
So right now, a third of our patients in the state are considered overweight, and another third are considered obese. With that comes a lot of risk factors for other diseases, most importantly diabetes, which we have also seen that rate double in the last 20 years in the state of Delaware. And so we've seen what we would consider an epidemic of obesity.
You mentioned obese versus overweight. What's the difference between those two things, and what is the risk difference between those two?
Overweight is a BMI of 25 up to 30. A BMI of 30 and above is obese. Of course, the higher the BMI, there is greater risks of obesity-related comorbidities.
One of the scary things that patients tend not to know about is the increased risk of cancer when it comes to obesity. So it's not a cosmetic disease. It really is a health risk. And for clarity's sake, a BMI or body mass index is a height versus weight ratio. And it gives us a sense of how much excess weight a patient is carrying over their ideal weight. We rely on BMI because it's an easy calculation that we can do, that patients can do. You can find that calculator online. We try to collect data on our patients so that we can measure where they are at a time frame, and then we can help them towards goals that are based on numbers, but really more importantly, based on their health.
We're going to be talking about weight loss surgery today, and so maybe we'll start with what might be people's frame of reference for that. Shows like My 600-Pound Life, 1,000-Pound Sisters, things on TLC, Discovery. How accurate, Caitlin, of a representation of what you guys do are shows like that?
My 600-Pound Life has been out for years. It is a great show to talk about the success that some folks can have that are extremely overweight. However, that probably accounts for less than 0.5% of the patients that walk through our door and are great candidates for surgery. The surgery is for patients who have 100 pounds to lose, have 80 pounds to lose. When we're talking 400 pounds to lose, that's quite a lot. And so I love those shows because it gives folks a flavor of what bariatric surgery can do, but it really isn't a good representation of what we do on a daily basis.
So let's talk about what you do on a daily basis. Both of you, you're kind of on the two ends of the spectrum here in the weight loss community. How is ChristianaCare's approach different than other health systems in the region and on shows depicted on television?
Yeah. Christiana really does a good job of providing patients a lot of support throughout the process. Of course, it isn't just me prescribing medication or Caitlin doing surgery. There's a lot more that goes into helping a patient, which is really going to help them to keep the weight off long term.
What we do between dietary counseling and behavioral health support and anti-obesity medications and bariatric surgery, we have all of these options to provide to patients that are all varied in themselves.
Yes.
ChristianaCare does an amazing job with hiring on a bariatric, medicine colleague, a bariatrician. It is very unique to have that in the system, and we hope to have more Lisas coming on board. And then the bariatric program, it's a large continuum of care for our patients, and that was the commitment that ChristianaCare made to this community in treating obesity.
Lisa, Caitlin called you a bariatrician, a unique role, kind of nationally, I would think.
Yeah.
Talk about kind of the difference between your role and your role, Caitlin.
So my role is, of course, the medication aspect of treating obesity, but there's more than that. It's my job to also screen for things that may be contributing to obesity. I delve through their entire past, essentially. If there is some sort of a psychological component to why the weight has increased, then we plug patients in with therapists. If it's a patient that definitely needs surgery, then I will refer to Caitlin
to
and
my team. Yeah, and so I'm amongst 5 surgeons here at ChristianaCare that take care of patients who meet indications for bariatric surgery. And these surgeries, typically we talk about the sleeve gastrectomy and the gastric bypass.
Lisa, you talked about sending patients over to Caitlin for surgery. How do you make that distinction? Who is a candidate and who is not a candidate for surgery?
And that's a little bit of a loaded question in the sense that medications can only result in so much weight loss, right? So if it's more than 20% of their weight that they need to lose, it might be a good idea to explore the surgical options. It is possible even after surgery to add on medication.
Our insurers actually have like a set line to meet indications for surgery where it will be covered. A lot of that is based on our bariatric society's guidelines, thankfully. A BMI over 35 with a obesity-related comorbidity or anyone with a BMI over 40. But that's just kind of the numbers game, because really we're looking for folks who are committed to those lifestyle changes. We want folks who have tried other avenues for weight loss. Surgery is not a magic pill. Pills aren't a magic pill.
Pills are not a magic pill.
Weight loss is made up of multiple components to really be successful. And the first thing that a patient goes through is a seminar, but it goes over the risk of obesity. It goes over the risk of surgery, the types of surgeries, the outcomes, and also the risk of complications after surgery. And then patients come in and see one of the surgeons. And so they come in to see us, and it is a very emotional visit for a lot of patients because they're talking about their struggles with weight loss. I'm sure you've seen this too in your office. Yes. We always have tissues.
Always.
Because it is the time where we really want the patients to be very genuine in their aspirations and their hopes. And if the surgeon feels that they're a great candidate for surgery, then that launches them through a whole process. So they see our dietitians, they see our psychologist, so they get assessments by both of them for appropriateness. They go through a series of classes called life skills classes that goes over everything from how to read nutritional labels, healthy eating, exercise, how to even just going through stressful situations and how to cope differently than using food, for example. And then we also go through the diet before and after surgery and nuances with that, how to start vitamins, what kind of vitamins to take. They also see our Center for Surgical Optimization, CSO, which is run by our medicine and anesthesia teams. And those patients get prepped from a medical standpoint. So it's really interesting because they do a full cardiac and pulmonary workup for patients. Oftentimes we are diagnosing diabetes. we are diagnosing obstructive sleep apnea for the first time in a lot of these patients. And they also get an endoscopy typically, and then the patient goes to surgery. And it's a really fun day because there aren't a lot of patients that love their surgery day. Bariatric patients love their surgery day because it's a big change in their life. And I am honored to be part of that change for them. It's a long process, but that shows that dedication, that motivation to really make a positive change in their life.
Lisa, you talked about from a physical perspective, the difference between someone who's a candidate and not. What is also the difference in your mind from sending someone to Caitlin or saying we should be trying other things first? When do you know exercise and eating right just isn't going to do it?
There's so many aspects that go into everybody's weight loss experience and journey. And we have to make sure that all those things are addressed. And so what I do oftentimes in the visit, I say we focus on 4 things, which are essentially the 4 pillars of obesity medicine. Of course, diet and exercise. Medication is one part of it, but then that we work on habits and things. And I often don't want to send someone to Caitlin until I've kind of addressed important things that really are going to be impactful to their weight loss journey.
Caitlin, tell us briefly about the 2 kinds of bariatric surgery that you perform.
I'll start with the gastric bypass. It's been around for a long time. It's really been perfected over that time frame. And what we're doing essentially is cutting a small pouch away from the rest of the stomach, which limits how much somebody can eat at a given time. And then we also have that go down a tract of small bowel separate from the rest of the small bowel until downstream where they meet up. And that helps prevent the food that's going down there to interact with the enzymes that would break down that food. So that helps minimize how much gets absorbed into the body. The sleeve gastrectomy essentially is the removal of 70 to 80% of the stomach. Obviously, it limits how much somebody can eat in there, but it also helps with early satiety. And by taking out that portion of the stomach, we're removing hormones, for example, like ghrelin, that would make somebody hungry.
Lisa, you mentioned that some patients get that bariatric surgery and then continue to see you to really stay on track. What does that post-surgery life look like for patients?
We have to remember that obesity it's a chronic disease. It's not a disease of willpower. Sometimes with obesity, you might get down to a certain weight, but if the weight starts to creep back up, and if there's not a surgery that can be further done, medication is oftentimes what patients gravitate towards.
Yeah, it's just another tool.
It's another tool.
Yeah.
And I think that big emphasis on tool, right? Because like Caitlin was saying, it's not just the surgery, it's not just the medication. We have to have hit those other aspects that influence weight because there is no panacea, right?
Yeah.
So
after surgery, patients really do tremendous with their weight loss. In the first year and a half, that's when we see a significant weight loss. In the first couple weeks, patients will be losing a pound a day, a pound every other day. Within the first 3 months coming off their CPAP machine, their diabetes medications sometimes come off the day after surgery. But it is a long-term chronic disease that needs support. And so a lot of what we do collectively is provide support for our patients long-term. And we know there's so many studies on this that patients that are following up with a bariatrician, with a bariatric program, they are more successful in their weight loss.
absolutely.
Long term, yeah.
So what are you seeing numbers-wise for that success?
70 to 80% excess body weight loss in the first year and a half. And having patients come off of their blood pressure medications and come off of their high cholesterol medications because their lipid panel at 6 months looks beautiful.
Yeah.
I mean, just even sleep apnea alone, we see resolution rates of over 85 to 90% at 3 months.
That's amazing.
Yeah, but over time we can see weight regain. And so I tell my patients, I want to know when you've gained 5 pounds, not 50 pounds. Mm-hmm. And I also tell patients to kind of live within a range of about 5 to 10 pounds. If you're hitting that upper level of that range, come in and see our team so that we can help get folks back on track with whatever they may need.
Yeah, I couldn't agree more. We never want to go back.
Yeah.
And you have a bariatric cookbook, a Facebook group. You guys are really investing in this community.
Yeah, it has been a labor of love. We realized that patients were struggling to figure out recipes, and they were going on Pinterest and they were going all these other places. And I was like, they need to come to us. It's 170 pages of amazing recipes, easy recipes, holiday recipes, recipes for every stage, because patients have to go from liquid to puree to soft to regular after surgery. So, and then the Facebook page is probably one of my favorite things. We created this a couple years ago. We have 900 patients on the Facebook group now. They post multiple times a day. Hey, I'm going down to Glasgow. Who's going to come meet me for a little walk in the morning Saturday? I'm going to Orange Theory. Let's go. And also, hey, I'm struggling today, and I want to get back on track. The patients really created the magic there.
What's the best recipe in the book?
So one of the favorite things actually comes from the puree stage of food.
I was not expecting you to say
I was
that.
going to say, yeah.
No, it's called a ricotta bake.
Oh.
Yes. And so it's the first time that folks are getting something more solid-like in their diet. It feels like a real meal. They can cook it for their whole family, but they're secretly on a puree diet.
Before we wrap up, we have two experts in obesity and being overweight with us, so we'd be remiss if we didn't talk about the growing visibility of anti-obesity medications in popular culture, in just the general zeitgeist in the country. Can you guys address that a little bit?
Yeah. So, of course, everyone knows about the GLP-1 agonists, which are the injectable medicines like Ozempic, Wegovy, that a lot of the celebrities are using. Sometimes those medications aren't appropriate for patients based on medical history. I think they are great medications. They're a great tool to have in our arsenal of treating obesity, but there are others too. There's oral medications that we use often. While the GLP-1 agonists have really gotten a lot of publicity lately, that's just one medication group that we have.
But just like surgery, medication needs to be tailored.
Right.
The right medication to the right patient based on their symptoms. It is kind of funny. We see that all the time. Hey, the celebrity's on this medication. I'd love to see that too. But really, we have to make sure that we take a step back and really look at the patient.
Right. Some other medications are better for other things. If we have stress eating or we're trying to target specific cravings, then Ozempic might not be the best thing for that.
The medications aren't without their own risk.
Sure.
And so
That's a great point.
We don't want to start somebody on a medication who doesn't have, an extreme amount of weight to lose. Right. Not to say we can't help folks with a BMI less than 27. We just help them in a different way.
In a different way.
Caitlin and Lisa, thank you both so much for your time today.
Thank you so much.
Thank you.
And we'll have more information on ChristianaCare's Weight Management Center and a link to ChristianaCare's Bariatric Cookbook in the show notes for this episode at ChristianaCare.org/podcast.
I cannot wait to try some of those recipes.
Absolutely.
And while you're at ChristianaCare.org/podcast, you can subscribe to For the Love of Health on Apple Podcasts or Spotify. And while you're in the apps, leave a review. Help more people find the show.
And we also love to connect with all of you on social media. Just search at ChristianaCare.
We're going to be back in 2 weeks with another great conversation.
Until then, thanks for joining us for the love of health.